learning about gut health and a trending parasite cleanse and healthy living with naturopathic doctor Jacqui Fleury. Good morning.
Good morning, Chantel.
So this is an interesting topic. What is the relevance of this?
Well, as you and I talked about, clearly your algorithm isn't showing you anything about parasites just yet, but it's a very popular topic on social media, and as a result I get asked the question probably several times a week, should I do a parasite cleanse?
Okay, so is it something we should be looking at, and symptoms,
Yes.
that sort of thing?
It's a good question, and the best way to understand parasites is to think about your gut as if it's a garden. So we've used that example many times in our conversations. And if you think about your gut as a garden, it has weeds, it has flowers, and then there's the compost, which is the food that you eat on a regular basis. And so if you have a weedy garden, the medical term for that is dysbiosis, which is an imbalance in the good microbes versus the unfriendly microbes. And parasites essentially fall into that category of the unfriendly microbes. And if you have a weedy garden, then you become a better host to having an overgrowth of some of those microbes that we maybe don't want to have an abundance of in our guts. And so parasites just happen to fall in that category. So rather than looking at, should I do a parasite cleanse, it makes more sense to think about the overall health of your terrain, the health of your gut, and to think about if you're gassy or bloated or noticing diarrhea or constipation or a combination of all of those things, you probably have an environment that is conducive to being a good host to unfriendly microbes taking up residence in there.
Okay, so how would you know that you do need to maybe look after your gut a little more or really focus on gut health?
So there are different ways that we can look at the health of our gut. We can obviously go by symptoms. Sometimes you can do a stool test that is often very inconclusive. It doesn't give us a lot of great information. There is a blood spot test that we can take that tells us what kind of metabolites our gut is producing. And if we tend to be showing metabolites that are more pro-inflammatory or might be an indication of an overgrowth of those microbes, we'll see certain markers change in your bloodstream. And then standard blood work, sometimes your white blood cell count will go up a little bit. But really, we just go by those signs and symptoms. And again, we're not necessarily diagnosing a parasite. We're saying, hey, you've got an imbalance in your gut, and let's weed your garden.
Okay, so you can kind of keep tabs on your gut health, do those things like supplements, dietary needs, and you might not need the cleanse if you just keep up with your overall gut health?
Yes, absolutely. So I think things like increasing your fiber, having a good probiotic, eating fermented foods, those can all be useful ways to positively impact the terrain, so to put good things into your gut. But if you're already quite out of balance, let's say you have a history of antibiotic use or other medications, or you're under a lot of stress or have a lot of sugar in your diet, there's different things that cause you to be more weedy, so to speak. It feeds some of those microbes in your gut that we don't want to have overgrowing. So sometimes we have to be strategic about it. So that's where things like the sludge comes in. I use other antimicrobials. So there's ways that we can get out and ahead of that imbalance. But the bottom line is just looking at the gut as an ecosystem rather than targeting one particular microbe or pathogen.
Okay, focusing on gut health this morning. Jacqui, thank you so much.
Thanks for having me.